Hello everyone, this is Saman Salim and today we will talk about a very important AMC clinical case that is about poisoning. This case has come numerous times and it was causing some great anxiety in students, so I have decided to make a video about it. So let's start. An 18-year boy, Adam, was brought by his friends to emergency last night with loss of consciousness. His friends told that he was partying in the club last night where he engaged in a fight with his girlfriend. That he has taken some drugs and lost his consciousness. On admission, his GCS was 3 by 15.
After his initial resuscitation, his GCS progressively improved to 9 by 15 and then 14 by 15. His toxicology screen came positive for alprazolam and MDMA or ecstasy. For last 4 hours, his GCS has again started to fall back to 9 by 15. His liver enzymes are also markedly elevated. His father Max is here to talk to you about his son's condition. Tasks are: take relevant history if needed. This should not take more than 2 to 3 minutes. Counsel the father about Adam's condition and further management plan. Answer any questions that his father may have. Now, this is a scenario which has come numerous times and it was causing some great difficulty. So let's discuss this scenario. Now, before going into the task that we were provided, it's very important to understand the drugs that this kid has taken. Number one important point here to see is that his age is 18 years old. So we have to see if we have the permission to talk to his father about his condition. Secondly, he had a fight with his girlfriend before he took the drugs. So there may be some suicidal tendencies. So that is the point we have to cover in the history. How was his mood? Has he ever tried to commit suicide before? So these are the things that we have to cover in the history. But besides that, the two drugs that they have given, one is alprazolam, which is a benzodiazepine. And on that, it's a very short-acting benzodiazepine. Its effect, it starts immediately. It lasts only up to 6 hours. It's a CNS depressant drug, which explains his falling GCS. And the other things that we should be knowing is that the alcohol increases its toxicity. So now this kid was partying in a club, so he might have consumed alcohol. And also that his liver enzymes were markedly elevated. So now those liver enzymes, they can be because of the alcohol abuse. So we have to keep this thing in mind and we have to cover this point in the history as well about his alcohol abuse. And now alprazolam, it can be a prescribed medication. So we have to ask the father whether he was taking any sleeping pills or whether he was prescribed any drugs for his any medical condition. Does he have any medical condition for which he was taking any routine drugs? Another thing that if the liver is not functioning properly, which in this case it is not, so it prolongs the duration of action of benzodiazepines. So normally the effect should be cleared within 6 hours, but if the liver is not functioning properly, it may take a longer duration. So that is very important to understand in this case. The other drug that this kid has taken, it's basically a stimulant drug. Exact opposite of the drug that he has just taken. Again, it's a very short-acting drug, only up to 6 hours. But if this drug is taken IV, it can cause cerebral hemorrhage. And it can be inhaled, snorted, smoked, or IV route. And in this scenario, we are not given any information about the route with which he had taken drugs. So we have to ask the father about this as well, if he knows this information or not. So there are a few things that we need to ask father about in the history. So let's start that. In the history, you need, number one, as the child's age was 18, so we have to ask to have the permission to discuss Adam's condition with Max. Then you have to show empathy as his child is in the ICU and his condition is continuously worsening. Now, were you aware of your son's drug usage? Now here, be very careful as to not to use the term of addiction. Were you aware of your son's addiction? No. Were you aware of your son's drug usage? He may say that yes, my son was using drugs for this condition or he was just using occasionally with friends, but he is not addicted.
So if he says yes, then you have to ask since when, which drugs does he take? Do you know about the source of this drug? Was it a prescribed medication? Does he have any addictions? Does he abuse alcohol? So these are very important points that we need to cover. Now, the other aspect that he had tried to commit suicide. So why do you think that your son had this drug overdosage? Was he unhappy with his life? Was he sad most of the time? How was his mood? How is your relationship with your son? Did you notice any change in his behavior? Has he started to give his valuables to his friends? Was he, again, this was he prescribed these medications? Then about his general health. Also, you have to cover about his liver, that are there any liver problems running in your family, or were you aware of any liver problems that he might have? Has he recently traveled anywhere from where he may have gotten that hepatitis? So now in the counseling section, firstly, you have to explain the whole situation that is going on to the father. That is, Mr. Max, as you know that your son was recovering well since his admission to hospital, but since noon, his GCS has started to fall back, which simply means that his brain is sleeping again. Right now, it's 9/15, but if it falls below 8, it means that your son has gone to coma and he will need some ventilatory support. Let me explain to you about the drugs that he took. One of them is benzodiazepine, which puts the brain to sleep, and the other one is amphetamine, which basically lights up the whole brain. So their effects are exactly opposite. As soon as he took the drugs, the ones that put the brain to sleep, they started acting and they made him unconscious. Then the other drug that also entered in his system, it counterbalanced the effect of the first one, and thus your son was improving. But now his condition is deteriorating again, and there can be a number of causes for that. We are not sure at this stage what is exactly causing it, but we have some things in mind that may be the cause. Our results show that his liver is not functioning well, which means that the body is not able to get rid of the toxins which are building in his body, and that can be one of the causes. This is what we call as metabolic encephalopathy. Secondly, if your son has hit his head somewhere during the fall when he lost his consciousness, it may have caused some brain concussion or hemorrhage. So that can be one of the cause. Thirdly, as we don't know the exact route of the drugs intake, for example, if he had injected amphetamines, it may cause hemorrhage. Fourthly, as his liver is not functioning properly, the drug benzodiazepine, which basically puts the brain to sleep, it is not getting effectively cleared from his system, and that can be one of the causes. These drugs also disrupt the electrolytes in the brain, which can cause shrinkage or swelling of neurons, and can be one of the causes as well. After explaining the causes of his deterioration, now you have to tell about the management. So, Max, we will continuously observe your kid. We'll be continuously monitoring him. We will be checking his GCS and vitals. Now, as your son is, his brain is not fully awake, so his airway management is very important. We have to ensure that he keeps breathing and no fluids from his stomach, they go to his lungs. And we have to prevent that. And if that happens, we have to detect that early and manage that. Then after consulting with our senior specialist and neurologist, we will arrange for a CT scan or an MRI to see the signs of any concussion or hemorrhage. We will also arrange for an ultrasound abdomen, and we will also perform all the hepatitis serology tests to find the cause of liver dysfunction. We can also check for the serum ethanol levels. We will also test for electrolytes, urea, creatinine, and blood gases to see that all the other systems, they are not contributing to his worsening condition. Then his bowel and bladder care is very important. Also his pressure points care. And we will also discuss about the use of flumazenil, which basically reverses the effects of benzodiazepines. And after that, after having a conversation with my senior, I'll update you about our further management plan. At this stage, do you have any questions? Please let me know. So this was my take about this case. Please let me know if you have any questions. Thank you.